One technique that I like to use with my physical therapy clients to help restore their functional mobility and also decrease their pain and discomfort is what we call manual therapy. Manual therapy is a joint mobilization, meaning a technique to go in there and restore the joint movement of that actual area. So when we think about every joint, especially the major joint, such as the hip, there's a movement pattern that should happen in that hip. But when we think about it, sometimes the limitation isn't just because of maybe a lack of strength of the muscles around the area or an imbalance. It's due to what we call the capsule or ligament that surrounds that actual joint, limiting its ability to move. Now, when you want to think a little bit deeper, there's different parts of that capsule. For example, anterior, the front, superior, the top, posterior, the back, or inferior, the bottom. Different parts of that capsule can get locked in or tight. And respect to someone's hand dominance pattern, right versus left, that goes a little bit more detailed, but we'll go in there and look at which area that capsule is not quite moving that's keeping that joint restricted and limiting its ability to move. Just remember, if there's less movement of that joint, then what ends up happening is there is more pressure in the joint, thus a quicker actual pressure to the cartilage, maybe a wear and tear, what some people call arthritis, or just a disconnect of actually how the alignment happens at the joint, to the point where the muscles around there, where the bones go, the muscles go, they don't line up as well, and thus you can't get a good contraction of strength or connect with the joint receptors. So a lot of moving pieces that people may not think about whenever a joint doesn't move. Now, when you want to compare it to maybe a chiropractic adjustment or someone going in there and doing a manipulation, it's different. Now, this is the technique is more what I feel like long-term solution, because what you're looking at is playing a game with also the nervous system. So whereas adjustment may be great or manipulation is needed in certain areas to go in there and have a forceful manipulation, whether it's at the spine or different parts of the body, that maybe a chiropractor or someone in that skilled movement does to open up the area. I'm also thinking about a little bit more encompassing whenever it comes to the whole holistic area of that joint itself and the surrounding parts. We're playing the game with the nervous system. So when we think about every major part of the body, whether it's the actual capsule, the ligaments of the joint there, or maybe the surrounding muscles, tendons, or even just in general, cartilage, such as joint receptors, all of them have receptors that feed the nervous system. So if we go in there and work with the body, then we can get more inclusive, as meaning also looking at the whole surrounding area to loosen up versus just maybe manipulating or adjusting one area. So I feel like you get just more out of it when it comes to open up that whole joint. Also playing a game with the nervous system where you get it more relaxed, opened up. So then it's more lasting. Then we'll follow it up with the mobility and movement program. So the key again is understanding how to identify what area of the body is not moving, go in there and do the manual therapy based off the mechanics that should happen as far as the general movement of that joint, because every joint again has a different movement pattern. Restore that movement through different manual therapy techniques, different grades of how much you press. So it's not painful, it's just a technique to go in there and loosen up, and then we'll follow up with a movement program. So this is what I feel like is key to a lot of missing pieces when people are trying to either restore movement, maybe they're overcoming an injury, trying to return to sport activity, or just in general, they can't figure out why they have that continued pain or discomfort. Well, there's something in the body that's not quite moving like it should. It's locked up and it needs to be unlocked. And that's where we go in with functional movement and look at the actual manual therapy to release it, followed with an exercise program. And that's how you optimize your human function and performance.